was really very frightening. We had very little information. It was still considered to be the gay plague.
People still needed and will always need information.
The information environment was extraordinarily different. No email to facilitate communication among each other. No internet to go on to.
The library was a place that people could come regardless of their background and feel safe asking the questions that they maybe couldn't even ask their own doctor.
We wanted people to feel welcome and
safe.
And safe.
Part of why that mattered is because in a world in which nobody knows anything, often the person living with HIV would know more than their doctor, could be more up to date than their doctor.
Based on my love of history, anthropology, I had, and fear and concern about becoming infected. Who knew what that was or what that even looked like? I had been gathering information, reading everything that I could get my hands on, and just kind of tearing the information out of books, out of magazines, and started to compile it into some sort of system of information.
It was not easy to assemble information, and a lot of the information was spurious. It was hard to tell. And it had to be organized by hand and photocopied and put in files. And it wasn't like the information could get to you. You had to come to the information. That was a whole different environment.
I had the beginnings of a collection of information. We had documented the need for information from a group of people who were really vulnerable and dying off quicker than we knew what to make of it. And John Hunt got me to John Cunningham, and John Cunningham then worked his magic and put together a group of people, and the rest is kind of how the AIDS Library was born.
Well, it wouldn't have existed if that group of people had not decided that it needed to exist.
I remember how after work you'd see everybody at Graduate Hospital. You wouldn't go to the bar, you'd go to Graduate Hospital
Yes. Yes, and this was at a time when your food, your meal tray was put on the floor outside your door, or it was put on the floor and kicked in. It was very painful. At that point, we had brought into the umbrella, actually the AIDS Library had changed its name to the AIDS Information Network. We had conceived of an umbrella organization, the AIDS Information Network, under which was the AIDS Library of Philadelphia, the Critical Path AIDS Project, which was Kiyoshi Kuromiya. I'm very proud that all those projects that originally grew up under the umbrella of the AIDS Information Network are alive and well today. The rest is history.
That was right after protease inhibitors and antiretrovirals. Well, not right after, but they had started to make an impact on the lives of people with HIV. That's what was probably one of the most extraordinary things about when I started as the director. It meant that suddenly people had a future. which they had not thought that they would have before. So it was an extraordinary period of time in terms of that. The library was providing the same kind of services that it had always provided, which was unbiased information in a range of things, not just around the drugs, but still people were very, very concerned about transmission, and had all of those myths about HIV transmission were still prevalent then. The idea that, you know, if you were a heterosexual man, you could never get HIV. Those myths, they still existed. That women didn't get HIV. That it was a disease only of drug users. It was a disease only of homosexual men. Those myths existed. Philadelphia Fight was a research institution, and had always been a research institution, and an institution around education for people with HIV. So with the library's resources, the education could expand, and we were able to enrich them with our resources and our knowledge and our approach towards information.
We inherited the AIDS library in the late 1990s, and by then, there really were some challenges that the library faced in maintaining relevance. I mean, there were a number of things that were happening. Around then was also the time when the National Library of Medicine first decided to make Medline. First, in the 90s, they made the AIDS line free. So the need for people to come to the AIDS library and look something up in a scientific journal for people who actually had access at home was becoming less and less and less. But at the same time, the epidemic was shifting in Philadelphia as every place else. And the people who were increasingly affected by the epidemic, who were the more disenfranchised people who had in effect been denied an education, people who wouldn't have the resources to get a computer at home, and people who needed assistance started to be the people who wanted to be able to utilize the AIDS library.
And they were able to bring to the table this extraordinary population, especially through Project Teach, who really needed the resources of the library and who the resources of the library could serve. Well, let me just step back and talk about the volunteers, because the volunteers of the library have always been their strength. And that was before we merged with Philadelphia Fight and after we merged with Philadelphia Fight.
You know, just caring individuals who stepped forward.
So I think one of the great strengths of the AIDS library is the staff that works there now. Juliet Fink is our education director, and you know, Juliet has just been wonderful, just wonderful. I think that Ben Remsen is probably the person who the users coming in have found to be the most approachable and the most helpful ever in the, like, I don't know, 13 or 14 years that the library's been at Fight. And Allie, I mean, you know, it's like you can't say enough about Allie. I mean, Allie was working at the AIDS library at the point at which Fight took it over. So, you know, Allie is just really sort of the strength and the heart and soul of the AIDS library.
Just want to congratulate them for 25 years of being there for not just for people with HIV, for poor people, for people of color, for anybody that feel comfortable, they could come here and get the help.